Hello, my dear ones. Dr. Morse here. I thought I would do a part 2 to the cold and flus, since everybody's going into them. You know, when it's cold, I grew up farming and a lot of milk drinking, and we always had cold and flus. Shoot, man, I used nose drops to breathe. That's how clogged up we all were. No one ever said it was the milk, you know. Until I grew up and started getting into health, did I understand that dairy products were one of the most mucus-forming, congesting foods on the friggin' planet. You know, no animal drinks milk after they're weaned. And man weans the babies way too late. And so, important to understand a few things going back a little bit. Understanding it in true science and in chemistry. There's only two sides to it. There's only two sides to chemistry. There is nothing in this world that happens out of happenstance. If you understand a little physics and chemistry, everything is cause and effect. Nothing just happens for no reason. That's medical thinking. That's why there's this concept or illusionary concept of diseases. They don't understand the cause and effect scenario. And if you don't, I don't know what to tell you. You're lost in space and trying to treat your problems and taking cold and flu medications and suppressing your body's need to clean itself out. So when you look at the two sides of chemistry, and it's very important to understand this for so many reasons. And I'm going to do another video on the lion diet to help you to understand why you don't do that one. And then also you need to know why chemotherapy is a crime. But understanding there's only two sides of chemistry, and that one side is the alkaline or base side, right? That's your hydration side. That's the I feel good side of chemistry. Anti-pain, anti-spasmodic, and in certain terms, anti-inflammatory. That's your fruits, your berries, your melons, your carbohydrates, generally, your sugars, which is the number one factor in mother's milk, is sugars. Simple sugars are essential. It's just man has ruined the whole concept of sugars with complex or processed sugars, refined sugars. And yeah, you take this chemistry into levels that are not good for you, of course. It's not what nature does, you know. Nature doesn't process its foods, only through the natural process of germination and growth and that sort of thing. So the other side of chemistry is obvious. That's acids. And there's nothing nice about an acid. Now I say that, and then estrogen and testosterone, these are minor acids. And if a woman wants to have no vaginal dryness, she wants to have a little bit of estrogen. And estrogen is what we call a minor acid. So when you look at the pH factors, and I'd love everybody to get into using pH papers, testing their saliva, testing their urine, because the only place you should test acidic is your urine. Your saliva should never be acidic. Acids are corrosive. They are a glomerulate. So what happens is they make your body stiff and tight and sore. They create tumors. They create the word inflammation. They're dehydrators. So a good example, you're out taking a run, you're creating a lot of lactic acid, you increase respiration, so you're increasing a lot of acids produced by your body. And then, of course, just from digesting and metabolizing your foods, the byproduct of Krebs and all these cycles are acids, like ascorbic acid is just a spin-off of the Krebs cycle. Well, nothing is friendly about an acid. That's why people take vitamin C, burn their stomachs and things like this, and they have to get buffered vitamin C. People use vitamin C intravenously for cancer, which is what they call cancer, which hardens their arteries. And no. Acids are the byproducts generally of your car exhausts, of burning fuels. And so fuel is generally alkaline in nature. And that's where you find the carbon side of life, the energetic side of life. That's energy. And we need that. People mistakenly think we burn protein for energy. That's not true at all. Your body never burns protein for energy. If it does, you become emaciated pretty bad. You can't go on a high protein diet and expect to have energy. You see this in Ensure and some of these baby formulas even, where they have 30 grams of protein and 1 gram of sugar. That is the most stupid, insane thing I've ever heard of. Mother's milk is about 7.5% carbon, about half of that, 3%, a little over 3% lipids. That's your lymphatic system. And then about 0.8, 0.9% protein. Well, wait a minute, that's the formative years, right? That's when the baby needs growth factors. See, so there are a lot of illusions cast out there that you have to get beyond. Because if you don't, you fall victim to these, you hurt yourself. And that's what's going on out there. So these two sides of chemistry are the only two sides that exist. Your consumption, it always needs to be on the alkaline side of chemistry. Your foods need to be what we call alkaline-ash. As Arnold Ehret said, mucus foods. Mucus-forming foods. I mean, foods that don't cause mucus buildup in the body. That's your fruits, your berries, your melons, and your veggies. Right? Your byproducts of all that are acids. They need to be eliminated out of the body. So going back and looking at your physical body very simplistically, take a look at this. Your physical body is only about 100 trillion cells, give or take a few trillion. It seems to change every year. So you've got all these cells, and cells are known as structure, function, right? That's everything, structure, function. But what takes care of the cells? And that, of course, is your blood and your lymph. Well, your blood is your kitchen. There's no eliminative organs to the blood. There's the spleen, it's a lymphoid organ that cleans your blood. But your blood is your kitchen. That's where you get your nutrition. You can't acidify your kitchen. Then ask someone why you would put chemotherapy into the blood. Because if you acidify your blood, death can be very quick. So you can't acidify your blood. Anybody in the medical field knows that, or you shouldn't even be in the medical field. That's insanity. So very important to understand these two sides of chemistry, and that everything in nature, colors are acid and alkaline. Thoughts, acid or alkaline. Your foods, acid or alkaline. That's just the nature of it all. And a lot of foods have an acid ash. So your proteins, your nitrogen-rich foods, your beans, your grains, most of your grains, all these types of food, pasteurized dairy products, these are acid ash foods. And acid ash foods get into the blood, and that's when you start having problems. Those on high protein diets lose calcium like crazy. Calcium is on the alkaline side of chemistry. And when you put acids in your blood, your body steals calcium right out of it. That's why when you see chemotherapy, you see the collapse of arteries, you see the aorta blown, you see all kinds of things going on because these jokers are creating a crime on you. They're putting acids right into your blood. No civilized society would ever allow that. That's killing you. That's of 100 people that walk into chemotherapy, only about 10 walk out. And years ago, it was only 6 walked out. So out of 100 people that walk in for your therapy, only 6 walk out alive. I mean, you got to really wake up to this sort of problem that's going on here, and they're getting away with it. And this is insanity from way back. So when you consume a high acid ash diet, first your body loses a lot of calcium. You start to see varicose veins, spider veins, bruising easy, petechia. You start to see all kinds of problems like this. Depression sets in, all kinds of things like this happen. Calcium is a main component electrically, a main component for connective tissue, a main component to your skeletal system. Oh yeah, you can't do that. So you have another system. So if your body has 100 trillion cells and only 2 fluids, so there's spaces around almost every cell you have, and those spaces are called interstitial. Interstitial spaces around all the cells. Why is that? You got to get nutrition to the cells. You got to get energy to your cells. But then again, what else do you got to do? You got to get rid of cellular waste. Cells poop just like we do. and you got to get rid of cellular poop, right? So what system is in the lymphatic, is in the interstitial spaces, and that's your lymphatic system. And that's a system that medical doctors are not taught about. And it's to their demise that this is a very serious a mistake. But then again, man has not understood this even naturopathically. I've been 50 years in this field, and in the beginning, man wasn't taught lymphatic. I wasn't taught much about the lymphatic system. I had to learn on my own. And I also learned and brought out the fact that your kidneys are the major eliminative organs of the lymphatic system. Your kidneys are you got a right kidney that drains the right side of your body and your left the left. And when you're not filtering, when you pee in a jar, and I challenge you to take the Dr. Morse pee in a jar test, and if you pee in a jar and your urine is clear, you're in trouble, because your sewer systems are not clear water. They have crap in them. And you need to see crap in your urine, and your crap in your urine needs to look like the snow in this snowball. You need to see your acids coming out of you, or the question is, where are they? And that's where you see the word inflammation, swelling, pain, tumors, cysts, boils, because your skin is considered your third kidney, vital to the elimination of waste. And you can always tell that wherever your lymph nodes are, under the arms, right? Well, your lymph nodes are your septic tanks. Every house has a septic tank to it, just about. You got to have a septic tank, because somebody's got to chew on those solids, right? Same thing in your body. You got bacteria in your lymph nodes that break down these acids, because cellular acids are 3 pH. We've talked about this a lot. That's Coca-Cola. And you don't neutralize Coke or 3 pH acid, and you pee 3 pH, you're going to be on your knees screaming, "Yow, God, burn, hurt." You can't do that. So bacteria is vital in your body to break these 3 pHs acids and get them up to about 6. And that way you have a little bit more comfortable pee, right? So vital. And then when cells are damaged in your body, your lymph cells take these damaged cells to the lymph nodes, where macrophages break them down, and then off that trash goes to the kidneys or the skin, right? You know, you can always tell when you're on these acid-ash diets, because you always stink or smell like the food you eat. So people that eat hogs and bacon and stuff smell like hogs. People that eat hamburgers smell like cows. I mean, you smell yourself. People that eat fruit don't have body odor. I can tell you, you got body odor, you're way too acidic and way too many proteins in your body. And so this breeds inflammation. And then, of course, those acids eventually damage cells. The process is atypical, and then into a mutated or a degenerative cell. The medical doctors happen to use a fancy word called cancer to a cell that's damaged, right? And you can't treat that. You can't go, well, you got a cancer cell, I got to go after that cell, and I got to take an acid in your body, and we're going to kill those cells. Your cells are structure function. You don't kill your cells that make up your body. That's insane. It's just an insane type of thing that if man doesn't stop that, these people need to go to jail, because this is insanity to even think about where that philosophy even comes from. You got to ask yourself as a practitioner, what damages those cells in your body? Your cells are just sitting there, but you have two fluids flowing around them, and blood never damages a cell unless you don't get it to a cell. But acids always damages a cell. And that's what you have to look at. So that's why when you get a cold and flu-like symptom, your body is telling you that you're too acidic, you're too much mucus in you, and you got to get this out of you. Because if you don't get this out of you, you start clogging up, you can't breathe, you lose your sense of taste and smell, all these things. And you just have to simply clean your body out. Well, that's what a cold and flu is. It's a detoxification process. Normal, natural, it's nature, not a disease. And cold weather instigates this. The body releases its own viruses. And you could pick up one or pick up something and initiate you into a cold and flu, sure. But if your body's clean, you can't get it no matter what. Check my videos on AIDS and things like this and how we've cleaned AIDS out of people, and they couldn't get it again if they tried. HIV, all types of viruses. But your body, when your body's acidic, it becomes agglomerated. Everything stays at home in there. Radiation stays in. Chemotherapy stays in. Why you would use these cell-damaging practices to treat an acidic condition of the body where the lymphatic system is stagnant. The kidneys have lost their ability to filter, and now all this waste are staying at home inside of you. That's where you get the swellings and things like this. So, instead of sitting there eating on a hamburger, I should eat on some of these. Go after these sweethearts. Look at these babies. I lived almost a year exclusively on oranges when I was 21 years old. Look at these puppies, man. These are big. And that's just what you need. Load up with fresh oranges. Some oranges are too acidic. Don't eat them. These are navel oranges, and navel oranges should be sweet as honey. And enjoy the ride. Get yourself cleaned out and hydrated, and you'll be fine. Get some sunshine too to help dry you out and to help enhance the function of cells. Full color therapy. You need full color therapy through those eyes of yours. Wearing sunglasses just takes away full color therapy. And like I said, colors, everything is either acid or alkaline. Choose to live on the alkaline side of life, and you will be the happiest person on the planet. Love you guys, and take care of yourselves.